This variant has a large number of mutations, and some of these mutations have some worrying characteristics. Right now, there are many studies that are underway. There's a lot of work that is ongoing in South Africa and in other countries to better characterize the variant itself in terms of transmissibility, in terms of severity, and any impact on our countermeasures like the use of diagnostics, therapeutics, or vaccines. So far, there's little information, but those studies are underway.
Countries around the world aren't waiting for those studies. Many, including Canada, have imposed a travel ban on southern African countries due to a new COVID-19 variant. The World Health Organization has deemed Omicron a variant of concern. Dr. Peter Singer is a special advisor to the Director General of the World Health Organization. He is in Vancouver. Dr. Singer, thank you for joining us. Why is it the World Health Organization thinks that it's preemptive for travel bans and these kinds of restrictions?
Travel bans under the rules of the road that countries themselves have agreed on are the responsibility of governments. What WHO urges is that they be risk-based and time-limited.
And so do you support the measures that Canada and other countries around the world have taken?
That's a call for governments themselves, but I think people should keep in mind two things, Katie. One is the effectiveness of travel bans. Today, the Africa CDC issued a statement where they said what they've observed through this pandemic is that travel bans on countries reporting variants have not yielded a meaningful outcome. I think that's a reasonable statement. Secondly, is the incentives for countries to report. Kudos to the government of South Africa, which used cutting-edge genomic science and was extremely transparent in reporting this. You want to incentivize countries to do that. So those are both considerations to keep in mind when governments are setting travel restrictions.
I understand that, it might be a disincentive for countries to report, but we're in a public health crisis and this pandemic is not over. On the surface, as someone who looks at this, if something is spreading somewhere, why wouldn't countries, throw up measures like what Canada, the United States and other countries are doing to try and as best as they can? I know that keeping variants of concerns out of countries is a very difficult game, but not a game. It's a very difficult effort. But, is it not just common sense if something is somewhere, try and do what you can to block it from coming in?
As I said, that's a responsibility for governments, Katie, but I think what's really important for people is there are things that individual Canadians can do in the face of news like this variant. And it should be really a message to make sure that you're vaccinated and to use the public health measures, namely masking, outside is safer than inside, be in well-ventilated spaces, use physical distancing. Vaccination and those public health measures work against all forms of this virus, and that's something Canadians themselves can do to reduce their own risk.
I know that this is still very early in terms of this new variant of concern, but what do we know so far about it?
What we know is that this variant, which was, as you said, designated today by the World Health Organization as a variant of concern and named Omicron, is spreading in multiple, the cases are increasing in multiple areas in South Africa. And secondly, that it's got a lot of mutations. That's what we know. And that's why it was designated a variant of concern, because it's also changed the epidemiology in South Africa. What we don't know is the impact on clinical disease and the impact on the effectiveness of vaccines. But we're working obviously hard with scientists around the world to study that and to figure it out.
I was going to say, how long might it take to learn just how effective vaccines are against this particular variant?
Could take days to weeks to learn that, and that's obviously critical information for people. But this is also a wake-up call, Katie, to vaccinate the world. In a sense, this was almost a foreseeable event or a foreseeable event because viruses naturally mutate. And the more they spread, the more they mutate. So with the current levels of vaccine inequity, 70+% vaccination rates in Canada, 7% around the African continent generally, You've got places where the virus is raging around the world, and that's actually how you create variants. So the way to make Canadians safe is to raise those vaccination rates and vaccinate the world. We've set a target of every country vaccinating at least 40% of their population by the end of this year. And that's something that we should all band together to do. And this variant is actually a wake-up call for us to redouble our efforts to do that.
If I recall correctly, the World Health Organization was advocating for wealthy countries to give the doses they had, not give the doses they had, but, before vaccinating people who are at lower risk, particularly children. This would have been back in the summer, before getting those shots into the arms of, teenagers and kids, getting them into healthcare workers in parts of the developing world. Is that something that you think still needs to happen, as kids in this country are rolling up their sleeves to get their shots?
Well, we do advocate for vaccines going to high-risk people around the world. I think it's shocking that almost a year into the global vaccination effort, only 1 in 4 health workers across the African continent is vaccinated. And so those people are at very high risk, and they need vaccines to protect themselves. There's 2 things that can be done to vaccinate the world, Katie. The first is to distribute the vaccines now. So for countries with extra stockpiles, to share those, to swap their doses with, for example, COVAX or the African Vaccine Access Team, to get those doses to people now. We need about 550 million doses to get to that 40% target by the end of the year. Secondly is sharing the technology, which includes capacity building, the intellectual property waiver, so regions can make their own vaccines. And you can see how important that is, either in the wake of variants or in the wake of future pandemics. So this is very important to vaccinate the world, and the variant should be a wake-up call for every country to share vaccine doses now, to raise those vaccination levels right around the world, so the virus doesn't rage, so it doesn't mutate, so variants aren't created. That is how to keep Canadians safe.
Do you think wealthy countries should be donating their vaccine supply rather than giving out third booster shots?
Yes. I mean, it would save lives if the vaccines went to the highest risk people, Katie. You want to give, as my colleague at WHO, Mike Ryan, has said, 1 life jacket to somebody who doesn't have one before you give a 3rd life jacket to somebody who already has 2. Last week, 51,000 people died around the world, most of them unvaccinated. And so those are the people at highest risk. And by vaccinating them, we save lives, and we also make ourselves safer by reducing the risk of variants.
We've got about 30 seconds left here. Where does this go next? I know that you don't have a crystal ball, and this news, at least in Canada, it seems to have come out of not nowhere, but it's developed very quickly. Where do things go from here?
Well, I think the key message is this ain't over. We may be sick of this virus, but this virus ain't done with us. And where it goes is for people to continue to lower their risk by getting vaccinated. And there's unvaccinated people in Canada who are often hard to reach, vulnerable, should be vaccinated. So if you're not vaccinated, please get vaccinated.
All right, Dr.
Please
Singh,
use the public health measures.
I'm going to have to jump in because we're going to go straight to commercial. Thank you, Dr. Singer. Thank you for your time.
Thank you very much, Katie. Bye-bye.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.